So there you go. Welcome, everyone. Thank you very much for joining us today, once again, in a community chat. Today is September 9th. Believe it or not, I feel that Christmas is around the corner, and I feel like Halloween decorations are starting to pop up everywhere, which makes me a little crazy. But anyway, so here we are. We continue with our community chats. Thank you for all your support. We've been running these community chats for a year now with over 50 education sessions for our community. And today we're going to be talking about a very popular health education thing, which is diabetes. We know that a lot of people over there suffer from diabetes, and many more people have diabetes and they don't even know it. I believe it's like 1 in 3 people don't know they might have diabetes. And there is so much, as we were just saying, that is happening in the diabetes field. It's like technology is being improved, treatments are being improved, new medications are being put out there in the market. I really feel that there is no excuse for people to walk around with high sugars, high blood sugars, because a lot can be done. And today we are going to talk about how technology is changing the life of patients with diabetes. And we have Jenna Kelly, who's a registered nurse here at Montefiore Nyack, and she's also the coordinator for the community education department, and also for the diabetes programs. And I'm very thankful to have her next door and to be, my co-worker. So thank you, Jenna, for being here. And I'm just gonna ask you to introduce yourself, because that's how I always start my community chat. So if you wanna tell us a little bit about you, how did you get involved with diabetes, and what is it that you do?
Okay, hi. Okay, thank you everyone for coming today. So yes, I actually work in the Patient and Community Education Department here under Sandra Aravallo, our director. I got into diabetes basically before nursing school. I was diagnosed with type 1 diabetes when I was 3.5 years old. And I felt like this was something that I needed to help people with. I was over at Westchester Medical Center when I was newly diagnosed. I loved the nursing staff. I loved how much they cared and taught, and that's what I wanted to do from basically childhood on. So I guess I'm living my dream. So thank you. But yes, I'm excited to share any technology, any news, any improvements with diabetes to hopefully one day have this kind of closed loop system where basically patients don't have to worry about checking the blood sugar and doing all this themselves, that hopefully computers and technology will catch up and help us.
Mm-hmm. And Jenna has prepared a beautiful PowerPoint for us to help us, recognize some of this diabetes technology that is coming to the market. And just so that everybody knows, we don't have any commercial engagements or anything like that. She's just going to kind of show what's out there from different brands and things like that, so that we learn to recognize all the equipment that is helping people with diabetes live better, longer, more effective and healthier lives. So Jenna, I'm going to ask you to share your screen and your PowerPoint with us. And at this point, I would like to invite all of our attendees that if you have any questions at any given point during this presentation, please use the Q&A boxes or the chat box. Anything you'd like to make us know what your questions are, and I'll be reading your questions to Jenna, and we'll be answering your questions along this community chat. So please make use of those tools and interact with us, okay?
Hi.
So go ahead, Jenna.
Okay, thank you. Okay, so again, the title of the presentation is Advances in Diabetes and Technology. That's my name. The first screen that we're going to talk about today is continuous glucose monitor technology. So this is those CGMs that people refer to them as. You've seen them on the commercials now. They're really getting out there. It used to be that these continuous glucose monitoring systems were only used in the type 1 diabetes community, but now we're seeing approvals for type 2. So what is a CGM, or continuous glucose monitor? I love this picture here because this picture really explains to you in detail what the CGM system is doing. So again, this is providing real-time data, which means it's pulling your blood sugar or it's pulling your glucose level, right, in your body into the system every 1 to 5 minutes and then updating you. So this is live glucose results that we're seeing from your body. So what do we have here? If you look in the picture, you can see that there's a transceiver, and then off of that, it looks like a little needle, which is called the glucose sensor. And that needle is embedded underneath the skin, the top layer of the skin, just barely beneath it, right? It's not even going deep enough that it's going anywhere near our blood vessels. And you can see the blood vessel there in red. So blood vessel, what are we talking about? These are our arteries, our capillaries, our veins, right? This is where you're getting your blood sugar from when you do a finger prick, when you test your blood sugar that way. So you'll see here, right? You'll see here, you see that lovely green arrow? That's showing you that all these little yellow kind of pill-shaped things, those are the glucose, right? So when glucose gets into your blood, it travels through your body, through the veins, the arteries, the capillaries. So when you're testing your blood sugar, that's what you're testing it from. You're testing it from the blood vessel. What these CGM systems are doing is it's actually testing your interstitial fluid glucose level. So what does this mean? If you see that green arrow, you can see that everything that's happening in our bloodstream, our blood vessel, is happening first. So your most accurate and up-to-date information is going to come from a finger stick. But anything that happens in the bloodstream kind of lags off later. About 5 to 10 minutes later, you'll see that data in your interstitial fluid. So you'll see here, right, that the glucose cells that are building up maybe in your bloodstream are eventually getting into your interstitial fluid, and that's what we're testing here. So just know that if there's not much of a difference, or there's not a quick rise or a quick deceleration in our blood sugars, right, where our numbers are pretty stable, these numbers are going to look exactly equal. But when we do have maybe a blood sugar rise where we're going up pretty high or dropping low, we will see a lag in this time. But this data is wonderful. It's giving us so much information. So here are the 3 parts to every CGM, or continuous glucose monitoring system. We have the sensor, right, which in the last picture shows us this is the little needle that goes underneath the skin. And all of the sensors that are available out on the market today, none of them use an actual needle, a sterile, right, sterile, hard needle. What they're using is this needle to kind of push this plastic cannula, because you'll see that that sensor looks a little bit wider. So what's happening is there's a needle, okay, located inside it, that once it's inserted into the skin, the back of the needle pulls out the metal portion, right? And then what's left underneath the skin is this plastic cannula. And so that way, if you move around, you bump it, it's not going to hurt you. It's not going to poke you because you no longer have a needle under the skin. Okay. So the sensor is the needle portion, right? Or the cannula portion that's drawing up the interstitial fluid and feeding it to what's on the back side of it, the transmitter, right? The transmitter is located right behind it. And what the transmitter does is actually transmits. It takes all that interstitial fluid data, pulls it in, and then it transmits it to your receiver. And your receiver can be anything from an actual receiver, a product designed to just obtain that information from the sensor, right? And it converts it into a blood glucose level that we know and understand. So it can be a receiver, like I said, manufactured by the company. It could be a smart device. Many of these now connect to cell phones. or it could actually even connect to your insulin pump. So all your information is right there in one place. So CGMs, they all look a little bit different. Like I said, this top one on the left is the one that most people are familiar with because it has the most overall approval for not only type 1, but type 2. If you look to the right of that picture on the top right, you'll see here's one that's working with the insulin pump and feeding data into it. And then on the bottom, these are two also different ones that are also used. And you can see here, the one with the picture with the patient has it between their fingertips. That one is actually implantable and inserted by your doctor. And I'll go into that a little bit here. So again, for the most part, they're worn on the back side of your arm. They are needleless once they are inserted, and all you're left with underneath the skin is this plastic cannula. So why would someone wear a CGM or continuous blood glucose monitor? Okay, if you see here, these little red dots indicate what we're getting, what the data we're capturing from blood sugars. So in this person, if you look, right, that gray area that goes across the screen is showing you perfect blood sugars, right? That's our range. If we look, for the most part, we think whose ever blood sugars these are, they're pretty good. They go a little high, maybe at 6 o'clock in the morning, right? Or 5:30. It looks like it's on the higher end of normal. During the day, it's normal. Then come dinner time, we're a little high, but we're not horrible. It looks like maybe that's like a 140, that red dot around the 1600 hours at 4 p.m. And then you can see by bedtime, we're back to normal. So capturing the blood sugars in this person, you're actually looking at it and saying, wow, I'm in pretty good control. But now we bring in the continuous glucose monitoring data. And there you can see in these graphs, whoa, we are missing a lot of information, right? We can see here that something is going on. Every morning, at 6 a.m., we're dropping low. We're having a serious low blood sugar. And then I'm not sure whether we gave insulin too early or what happened, but now did we overcorrect by giving, a pint glass of orange juice, or did we finally eat breakfast, or did we eat the wrong thing? By 9 a.m., we're spiking to a blood sugar in the 300s. So we know this is horrible control. And the fluctuations in these numbers are what causes a lot of the damage and complications from diabetes. So you can just see here from the alternate of doing 4 finger sticks a day in comparison to using the CGM systems, we're picking up a lot more data here. Again, this is the Freestyle Libre, the one that's approved the most for type 2. You can see on their receiver, what is it showing you? It's showing you the blood sugar number, the current blood sugar, right, that 112. Then in the upper right, it's showing you the trend arrow. And the trend arrow is used to say, hey, how fast am I going up? If that arrow was pointing straight up, we'd know, hey, we're rising pretty quickly. Straight across obviously means that we're pretty steady, and down means we're dropping. There's also a graph at the bottom that's showing you the last 8 hours of data, which is awesome because you can look back and use this information to decide, hey, look what happened when I, had 2 slices of pizza at dinner, or just it's giving you real-time data, real-time information that you can use, right? So what's great about this one is you do not need finger sticks to calibrate it. For the most part, years ago, all of the CGM systems needed you to do finger sticks and punch in that number from the finger stick into the system so that you could update it. So it could, re-register and make sure it was on the right track. Now they feel that these are accurate enough that they do not need calibration. It's going to capture data every every minute, and then update that reading in your screen every 15. The newest version, which is really cool, will alarm on a high or a low. So it comes with standard set that it's going to alarm once your blood sugar goes less than 70 or above 260. But you can make the adjustments on it so that, recently I had a patient who's healing their foot injury. And I said, right now, you really need to be in great control. He was able to go home and set these for really tight control to make sure that his foot was going to heal well. So this is great. The alarm is also great for who? Any patient who lives alone that does not know or does not recognize their symptoms of low blood sugar. This is going to alarm before you start questioning, am I having a low blood sugar? So this technology is phenomenal. The next system, again, this is still a CGM, is the Dexcom G7. This one is approved for use with multiple insulin pumps. What's great about this one is that it can use Bluetooth technology to transmit your data to other people, right? So how cool is this? I think about the older person living alone, and I think of our school-age child who has a parent at home who's worried about their diabetes control in school. This Bluetooth technology that's right there embedded in the transmitter is able to send the information to patients' phones, cell phones, smartphones, so that everybody can see. The school teacher can see it, the number in real time. The school nurse can see it in real time. The parent at home who's worried can see it in real time. So it just really gives a lot of information out there. This is the newest CGM on the market. What's great about this system? It's for somebody who does not want to get involved as much. It's for someone who does not like the needles or the insertion of the needle. This is something where you go to your physician's office, and if you see this little blue where it says sensor inserted #2 on the right-hand side of the computer, upper right, the doctor is actually using this small device to send this transmitter under your skin. And once it's under your skin, all they do is tape that up. And then for 90 days, you're wearing this system before they pull it out again. This system, you can see in the picture, the second picture from the left, that the person has that transmitter taped to the arm. The transmitter can easily come off and on. People like to wear this for what? So if they're going to a wedding, they're going to a party, they don't want anyone to see it, they don't want to use it, they can shove this in their purse or bag or pocket and just pop it on when they want to convert or send that information to your phone. And again, this one doesn't even have a receiver. Your receiver is your smart device. So this one also is a little bit different because instead of using the interstitial fluid to receive the data and convert it into what we call like the blood glucose level, this system actually uses fluorescent chemical in that little device that you see the person holding between their two fingers. And the more it lights up, right, the more that transmitter receives it and can tell how high the blood sugar is. So this one, again, uses a fluorescent chemical to measure the blood glucose status. So a little different, but still a CGM device. Okay, so what do we get out of this? This is really cool. All of them are downloadable to a computer, right? So with an app, you can download this information. So what are we looking at here? If you look at the top, you'll see Tuesday, Wednesday, Thursday, right? And little colors next to it. You're actually looking at the data for each day. So each color line here represents a different day that you're wearing the sensor. So they're overlapping. So doctors and patients can use this data to determine where their problem is. Where do I need to make an adjustment in my medication or make an adjustment in my exercise routine? It's going to give you that information. So on the right-hand side, you'll see the computer is actually, the app is actually giving you the information. It's telling you what we're seeing, right? So it's saying nighttime highs, most significant pattern of highs are found between 11:10 p.m. and 3:55 a.m. And you can see that from this graph. You can see that the in range is in that green area. The out of range is yellow and the low is in the red. So you can use this information and say, hey, look, on the left-hand side between 12 and 6, I'm basically high all the time. And the doctor and you can use this information to make adjustments. Again, these are the apps available. Some sensors have the Bluetooth built in. Some of them on the left-hand side kind of need this keychain thing to go with the person who's wearing the device to transmit that data. So benefits of CGM systems, right? It's going to minimize our high blood sugars and lows. It's going to provide alerts so that you're aware of them ahead of time. It's going to provide you immediate feedback. So if you had that, like I said, 2 slices of pizza, we can see an hour later what's going on, not 5 hours later when we go to do our next blood sugar check pre-meal. And we know which direction we're heading in. So we kind of have an idea of what we need to do. If I see that my blood sugar is 80 and I'm on the way down, I know I better stop and do something now before I'm having a low blood sugar. So long term, it's reducing A1C, and it's going to uncover undetected hypoglycemia. So what can interfere with it? Acetaminophen used to. Most of the systems that are out now, if you have a newer system, vitamin C is the only interfering medication. And it's vitamin C in large doses. This isn't vitamin C that you're getting in a regular vitamin. This is, vitamin C in like the airborne and those really medications where you're really taking vitamin C on your own. So if you are someone using this, we would advise you not to use it while you're using the CGM device. But again, a lot of them are getting better and are having less interference with different medications and vitamins. Okay. Oh, I can't hear you.
Thank you, Jana.
Okay.
So before we move into pens, a couple of questions. First, are these devices covered by Medicaid?
So yes, the easiest one to get approval of is going to be that Freestyle Libre system. That one's out there on the market. They actually even have a program right now where if you go online, you can get a free 14-day sample to try it out first. They all are approved. A lot of it has to do with your diagnosis. Type 1 patients are usually approved for the more advanced ones a lot easier, just because most of these patients, well, actually all of those patients are on insulin, whereas in the type 2 community, some of them are only on like 1 injectable a day or, just multiple pills. And that's a little bit harder to get approval of from the insurance companies.
And who can use continuous glucose monitors? Is it for everyone?
It really is for everyone. Now, I think everybody could agree that we're seeing a change where glucometers, even the manufacturers, are kind of sending everything, the glucometers away, and they're coming in with these CGM systems so that everyone can use it, because why not? I mean, we have all the technology out there for it. And the longer this technology is out there, which I think has been probably about 10 years, although you're only seeing some of these systems come out on the commercials. Why? Because, type 1 used to be the only one it was approved for, and type 1 only makes up about 5 to 10% of the diabetes population. So we're seeing it more, and why not use it in everyone to pick up that data? I mean, really, everyone who has diabetes can benefit from it.
Do you need to be on insulin to get it approved by your insurance, or it doesn't matter?
It makes it a lot easier. It definitely makes it a lot easier. The easiest way for approval is to be on multiple daily injections, as well as having hypoglycemia reactions. If your doctor can prove that you've passed out, you've had a lot of these reactions, an admittance to the hospital with hypoglycemia is going to get this approved. Why? The insurance companies want to keep you out of the hospital, and they want to save money too. So definitely multiple daily injections and hypoglycemia history is going to be the best thing, unfortunately, to get approval of it.
Can women with gestational diabetes have an insulin, a glucose monitor?
So right now, none of them are approved for use with FDA approved for use with gestational diabetes. And I think that's just because, they haven't been out long enough and they don't feel confident and what happens to the baby that we can't see if the data is not accurate. So I do believe that in the next few years we will see it approved, but I think it's just a matter of time for the approval.
Mm-hmm. And lastly, I thought that curve that you showed, with like the all different days of the week, that was pretty cool. So is it specific to one of the CGMs that you were showing, or all of them download similar data?
Right. So that one was specific to the Medtronic CGM system that's built in with their insulin pump, but they all graph very similar. They all have a slightly different looking screens, but they will all overlap when you use their apps and download the system. And a lot of these systems, you can then either bring the device, the receiver, to your doctor's office and they can download it there. It's usually an endocrinologist or diabetes doctor. Not every primary doctor will have the system. Or you can just view it yourself. So the technology is there and it's great.
Mm-hmm. Okay, let me check if there are other questions. No, I think we're up to date. So go ahead. Let's start talking about pens.
Okay, so these are the next slides that I'm going to show you is really, these are for people who are using insulin pens. So they're pen aids. So the first one, it's called the Insulin Check. What does this do? This is kind of snapped on. You can see in the picture here, it's slid onto the back end of the insulin pen. And what does it do? This one's pretty good. This is used for people who can't remember whether they took their insulin or not, right? So it's going to tell you the last time you took your insulin injection. It's going to let you know, right, that information so you don't double inject or miss a dose, skip a dose. The battery is replaceable. This does also let you know if the temperature gets too high or too low for your insulin, but most insulins can get up to 86 degrees. So it's great, maybe more for the person living in Florida or California or somewhere else. This one's a bit more, has a bit more information and a little bit more that it can do. So if you've had diabetes long enough, in the center of the screen, you'll see where it says Novo Rapid Pump Cart, right? Those are what the insulin pen cartridges used to look like before we had these disposable insulin pens, right? Sandra's nodding her head, right? So she knows these. So these used to get dropped into pens and we'd reuse the insulin pen over and over again, and we'd rewind it and set it back and reload these pens. So this pen works very similar to that. So again, you have to be able to use a cartridge with this in pen, okay? And what the cartridge has to be, really the only ones who make cartridges anymore are rapid acting insulins, our Humalog, our Novolog, and our Fiasp. And what we do is we drop the cartridge into the pen, and then the pen allows us to dial just like we normally would with an insulin pen, except for this is pretty cool. Not all pens dial in half units. This will allow you to do really small, fine doses. But it also, you'll see here the phone here, it also is taking the data from the pen and it's transmitting it to your iPhone. So what is it doing, right? Like a pump, it's allowing you to set reminders. So if you're someone who forgets to take your insulin, breakfast, lunch, or dinner, it can beep for you. It's going to do the temperature sensor, just like the other pen attachment. And this one allows for up to 5 people to follow your data. So again, someone at home, maybe we have an older parent, you can't remember whether they checked their blood sugar, and you can't, you're unsure of whether they're checking their blood sugar and taking their medication. So this way, they punch in their blood sugar manually into their phone, and then in this app, it's going to send their current blood sugar and the fact that they took their insulin over to, again, up to 5 people. Pretty cool. And again, it works with Android and other smartphones, and it is FDA approved in all ages. So that's it for pens. I don't know if there's any questions on pens. They're kind of simple. Nope. Okay. So Glucagon. Glucagon has been around forever, right?
Yeah, actually, yes. Sorry to interrupt. Yes, there is a question, because you know what? I've had patients that actually don't even know about the insulin pens. They're still using needles and vials. So I know you don't have a slide on that, but maybe you wanna just explain very quickly what the pens are as opposed to needles and vials, you know, for those people who are still on that old, very old system.
Right. And a lot of people that have been on insulin forever, the vial syringe method, are comfortable with it. But insulin pens are a lot easier to use. They also, many of the insulin pens can be stored at room temperature for up to 28 days, somewhere between 10 and 28 days, depending on the type of insulin. Oh, there it is. Thanks, Sandra. So insulin pens, right, instead of worrying about taking the vial of insulin out of the fridge and drawing it up and putting it right back in the fridge, this insulin pen that she's showing you is good for anywhere between 10 and 28 days at room temperature up to 86 degrees. So how cool is that? Easier for you to travel with. The other great thing about insulin pens is we're not using a syringe every time, you know, medical waste. Now all we're doing is changing out the pen tip, the needle tip, every time, and only discarding that, not a full syringe every time. You know, again, people that like vial syringe, they love it. But the technology is there, and it's a lot easier to do, to, you know, whip out of your purse or your bag, give the injection, and then just put it away in your bag, than having to worry about refrigeration and everything else. The insulin pens, though, you know, some people ask, oh, is this covered by Medicaid or Medicare or commercial insurance? It really depends on your carve out or cutout or whatever you want to call it. Every plan's a little different, and every plan covers things differently. For the most part, your commercial insurances will always cover an insulin pen. It really depends on what their preferred drug is. But for the most part, a lot of the insurance companies are approving insulin pens. It's just really which type.
I think that another advantage of the insulin pen is that you can dose your insulin a little bit more exactly. Because, you know, I feel like in the vials, either you go up too much or low too much, or you're not looking at it the right way, you know, but with the pens, it's like, since it has the dial in, right?
Right, absolutely, yes. Yeah, you're right. Absolutely, Sandra. She brought up a great point. It's so basically, you know, we have patients who have trouble using their hands, and you know, drawing up insulin is not so easy if you're not used to doing it. I know, you know, the nurses on the floors can do it 1, 2, 3 and get to that line, but it's not so easy if you have trouble using your hands or you have arthritis or something like that. The insulin pens are much, much easier to use, and you know, you're getting, absolutely, Sandra, that right, correct, exact dose.
Thank you, Jana. Thank you for that parenthesis.
Okay, good. Okay, so glucagon. What is glucagon? Glucagon is what we use to inject people who are having hypoglycemia reaction, right? What glucagon does is actually we inject it. It's always been injected into a muscle, right? So this is meaning it's a longer needle, right? Because we have to get past that fat tissue into the muscle. So it's a bit longer needle. And what we're doing is once we inject this into the body, it's actually telling your liver, okay, to send out glycogen. And when the liver sends that out, it's basically telling your liver to send out sugar to raise your blood sugar. Okay, so if you look at the picture here, right, this is very old school, vial syringe, which only many people know. It's only in the last 2 years or 3 years that we've seen big changes and seen things on the market. But again, the powder is stored in that vial. You inject the liquid into it, and then you redraw it up and inject it. And again, this is an emergency situation. Usually if you're using this, the person is not only having a low blood sugar, but it's so low that they're either unconscious or they can't drink the juice, right? They can't swallow. So this is used for an emergency situation. And again, more so in the type 1 community, but anyone who's on an insulin or anything that can cause a low blood sugar should have one of these kits with them. And I know a lot of doctors don't always prescribe it. So if you do have diabetes and you are on an injectable medication or on a medication that can cause hypoglycemia, you should have this kit around, okay? If not this kit, I'll show you here. maybe this kid. This one is pretty new. It's pretty cool. And I love this because this one goes in subcutaneously. So this one, the needle's a lot shorter. What's also cool about this, it's pre-measured. We don't have to mix it, right? In an emergency, the last thing you want to do is be fumbling around trying to mix something. So this is pre-mixed. It's ready to go. We don't have to worry about refrigeration or anything. And there's no visible needle. So much like those EpiPens where you kind of just jab, hold, and then you pull it out, and then it auto locks so you can't poke yourself again. And again, if you look at the left-hand side, this is showing, yes, kids need a lot less than our adult community. So their dose is usually half for anyone who is younger than 12 and less than 100 pounds. And I'm going to tell you later why I think this is so cool. And it has to do with the subcutaneous part. So that's called the G-Voke. This one is even newer. Okay, this is our inhaled glucagon, right? So anybody who is needle phobic or has, right, because who's giving you the shot? If it's somebody who has diabetes and they're passed out, they're not going to be giving it. You're relying on someone else to give it. So this is inhaled glucagon, and it's called Baqsimi. And what it is, it's a dry nasal powder, okay? And all you're doing, right, is just like this, right? You're holding the device between your fingers, right? After you peel off that lovely plastic that they don't show you. You're inserting it into your nose, and then you're pushing up on that button on the back end. You can see by the thumb where that green little line is. You're pushing it in until that green line disappears. And then once that's done, that powder has gone up into your nose, and we don't need to be, we could be unconscious and this will still work, okay? Because it's absorbed actually in through the lungs and then sent out into your bloodstream. So it's absorbed into your nasal passage, which is pretty cool, right? So we don't have to fumble with needles or syringes anymore. So that's it for glucagon. Any questions about glucagon? Okay, good. Okay, good. All right, so insulin pumps. Insulin pumps, there's a lot of information on insulin pumps. So I'm going to try and make it short and sweet and just tell you the newer technology with it. But I'll start out by telling you what they are, right? So what is an insulin pump? Many people know the pumps that we can see in the picture here. It's a device that's used to administer insulin subcutaneously, just like we take through our insulin injections for people who have diabetes. Who is a candidate for this? This is a person who has multiple daily injections, right? So if you just take, one shot a day of a long-acting insulin, or you take pills or something, this is not for you. This is for someone who either has type 1 diabetes, right? Who does not make any insulin, and now we have to get all our insulin from the outside of the body, or for someone with type 2 that really needs intensive medical therapy, right? So insulin pumps are inserted into the same spot on the body where we normally give our subcutaneous injections, the abdomen, the arm, the thigh, and our backside. You can see here the picture. It's just very similar to the CGM system, where again, you see the catheter underneath the skin. It's just going deep enough to get it into that fat tissue, and it's constantly infusing a rapid acting insulin into your body, okay? So here's just pictures of many different pumps, right? They all look a little different. Some are cheaper, you could probably tell by the pictures. Some are more expensive. They're all a little bit different. So here's one system that's a tubed system, and you can see we're drawing the insulin up from the vial. We're dropping that little cartridge syringe into the insulin pump, and we're filling up that infusion line, and we're inserting the insulin infusion set right into our subcutaneous tissue. And again, the needle is popping out the back, so all that's left under the skin is that plastic cannula. This is a tubeless system, so you'll see it's a bit thicker, but now we don't have a line anymore. We don't have an infusion line connecting us to the system. This kind of works like a remote control, where we're filling the pod with insulin. We're applying the pod, like a big sticker to the body, and then we're activating it with the remote control, the PDM, Personal Device Manager device. And anything we're telling it to do, we need to just keep that PDM device around to tell it, hey, I need to take a little bit more insulin. But that background insulin that I'll get into in a minute is constantly going to be infused. This does not need to be kept with you all the time. And we see that happen all the time when patients come into the hospital and they come in with the pump, the pod on them, but they don't have the device with them. So then unfortunately we have to remove it because we can't add insulin without that device. This is a very simple pump. Again, this one you kind of drop a cartridge into that's already pre-filled, and it uses simple technology. You hit a button to get it going. It's really not fine-tuned to you or specific. It kind of has certain settings on how much insulin that mainly people need. So again, you hit a button and it starts infusing over 24 hours. And then if you need to take extra insulin, you hit a little button, and every time you hit that button, it will administer 2 more units of that fast-acting insulin. So pumps use basal rates. That's that background insulin. So it's, basal rates are really done in tenths and even hundredths of a unit of that rapid-acting insulin, the Humalog, the Novolog, the Apidra, to really fine-tune your blood sugars. And then every time you're eating to cover carbohydrates, you're going to punch in that you're eating. It's also going to be used to correct a high blood sugar. So when you check your blood sugar, whether it's by glucometer or CGM device, you're now able to take specific insulin to meet the needs of that blood sugar. So again, I know I said I was going to kind of speed this up a little bit. This just talks about basal rates, which I explained. This is that background insulin that keeps your blood sugar level normal between meals. Here's a kind of showing you what basal rates look like. And you can see we're down to a hundredth of a unit being administered. And the cool thing about the pump, rather than using long-acting insulin, is that long-acting insulin, when we take that shot, maybe we take 24 units every night, that's split up equally across the time. Here, when we're using the insulin pump, we can fine tune this to meet the needs, really hour by hour. Carbohydrate ratios, again, this is determined by the physician and by how you react to it, and it's how much insulin you need to cover your carbohydrates. Correction factor, again, how much insulin is going to bring your blood sugar back down to target. And again, settings are made by your physician. So what else can pumps do, right? This is the bells and whistles. This is the part I was trying to tell you about, but I had to give you a little background. So pumps can calculate bolus dosages, right? Meaning your doctor, when you go on a pump, they're going to set everything in the background with you so that all you need to do is punch in your blood sugar and how much carbohydrate you're eating, and the pump's going to do all the math for you, which is awesome. They can now communicate with not only glucometers, but now these new CGM systems, and track, how much insulin is still active in your body. So if you just took insulin an hour ago, it's going to take into mind that you still have that insulin in the body, and maybe you shouldn't take so much right now. The limitations are exactly why not everyone in the world is on an insulin pump. They rely on the accuracy of the individual using the pump. So again, there's a lot of human error. There's a lot of guessing. You have to be really vested in this, in an insulin pump if you want it. A lot of people say, oh, it's in horrible control or she's in horrible control, let's put them on a pump. No, you have to be someone who's going to really concentrate on your diabetes to stay on a pump and have this work for you. Artificial pancreas, this is what we were talking about. Now the sensor actually, transmitter, the CGM device, can now connect directly to your insulin pump, and the insulin pump now is working like an artificial pancreas. This again is approved right now only for people with type 1 diabetes. Hopefully down the line we'll get type 2 in there. And again, that's because type 1 diabetes, we know the body's making no insulin. In type 2, your body's still making some insulin, and that kind of to get that into the algorithm of the insulin pump, who's making the adjustments or based on what your blood sugar is, it kind of, it's kind of like something else is being thrown in there. So it's a lot easier to use this system when we have type 1 diabetes. So it can be in this auto mode where basically you're relying on the blood sugar to adjust the insulin. And if I show you here, this just shows you, the pump is trying to keep your blood sugar between 70 and 180 all the time. If your blood sugar starts going above 180 with the use of the CGM system connected to it, it's going to give you a correction. If it sees your blood sugar going above 160, it's going to increase that fine tune, that hundredths of a unit to bring you back down slowly. And it's also going to shut down if it thinks that your blood sugars are going too low, that you could actually pass out from a low. The pump actually starts alarming and says, hey, are you okay? Do you want to do a blood sugar or treat your low blood sugar? So future insulin pumps, remember when I said that before, that I wanted to talk to you about that glucagon that can be administered subcutaneous? Now they're talking about insulin pumps that will not only have insulin in it, they'll also have this glucagon. And if they can both be administered subcutaneously, they can both be given through that same catheter. And how cool will that be for an insulin pump to be able to raise your blood sugar with glucagon if needed, or lower it with insulin, and have this whole system work together. So there are patients who've made these systems at home. None of them are FDA approved, and I'm hopeful that somebody out there will make one of these and get it FDA approved. But right now, with this new glucagon, subcutaneous glucagon on the market, we have a much brighter future. This is just a Freeza. This has been around since 2014. A lot of people haven't heard of it, and they said, why wouldn't my doctor give me an inhalation powder insulin versus an injection? So it's only this rapid acting insulin, right? So if you still need the background, the basal rate insulin, the long acting Lantus or Levemir or something, you'll still need to take that injection, but you could certainly use this inhaler. The problem, again, it comes in 4 units, 8 units, or 12 units. So, you'd have to basically specifically need one of those doses to cover your meal or something like that. And also, people who have breathing issues and other issues with their lungs, it's not exactly absorbed as efficiently or correctly. So again, this is great, but it's been around since 2014. And if your doctor never told it to you, that's kind of why. It works wonders for some people, but it's certainly not for everyone. This is 2014 too, a medication called GLP-1. I think this medication is really cool, and that's why I wanted to share. Not only, it's an injectable, and it can be actually daily or weekly. And this medication works very well to lower your blood sugars, but it also helps people who are trying to lose weight. So this, again, is only for people with type 2. Type 1 cannot use this, right? Type 1 people need insulin. But this certainly helps you with weight loss, suppressing the appetite. Even cooler, September 2019, they came out with this in a pill form, Rybelsus, which I'm actually really starting to see a lot of doctors start to prescribe. The only problem with the Rybelsus is once you've taken the pill, you cannot eat or drink, I believe. Yes, eat or drink for 30 minutes after taking it to make sure that it works so great. The last thing, if I have time, I don't know if I have time, Sandra. I thought these were cool, and I was doing a little research for this. These are siren socks. And we all know that people with diabetes run into foot issues a lot more so than everybody else. This is for patients, right, who are prone to foot injury and foot issues. We all know the patient that comes in all the time with the foot ulcers, and it winds up getting infected. And once we're infected, we're talking about sepsis or bone infection and amputation. So this is what this is for. What it is they're socks that connect right to your app, on your phone. And what it's doing is it's pretty cool. It tracks your steps for the day. So do a lot of apps, but it also is telling you the temperature in your feet. So if you have some kind of injury, it's going to let you know, hey, watch out, the temperature is rising in this area, maybe get to your podiatrist. And again, anyone who has diabetes, type 1 or type 2, should see their podiatrist once a year or more so, if recommended by a doctor. And I think that's really it. You know, there's pump sensors. There's a lot of other injectables out there. It's going to be what works for you, what you find easier. You know, this is not for everyone, but you certainly find your need. And now there's a lot of technology out there.
Mm-hmm. Well, thank you so much. And I know this is so much information to cover in really 50 minutes. So you did an awesome job. So thank you so much.
Thank you so much.
And yeah, of course. And, you know, for our participants, please ask all your questions. We only have 5 minutes left of Jenna here, and she's really an expert on these things. Not only because she keeps up with all the technology, but she uses it herself, a lot of it. So she really knows those things. So I have a few questions.
Okay.
CGMs and insulin pumps, you have the closed loop system, which is kind of integrated together. But if you don't have that system, can you wear a CGM and an insulin pump, even if it's separated at the same time?
Absolutely. So there are a lot of people who use one insulin pump and don't like the sensor that comes with that insulin pump, so they use a separate sensor. There's some people who use insulin pumps without sensors. It's really up to you. A lot of the pumps kind of have upgraded. Now it's kind of crazy. Insulin pumps are now upgraded by downloading them into your computer, right? They're not. You're not getting a new device every time, and your pump is then accepting the update where it can start doing more things, which is pretty cool. But the pumps themselves, you know, you can still manually punch in anything, and you can take it off this auto mode and put it on manual mode, where you're punching in your blood sugar, you're punching in your carbohydrates. You're letting it do the math, or you could actually completely eliminate all that and do everything yourself. But there's a lot of tools out there to help.
Mm-hmm. Mm-hmm. I saw that you showed two different systems, the wired and the wireless system, also for the CGMs.
Right.
Is one better than the other?
So it's preference. You know, I used to work in pediatrics, and a lot of the young girls kept saying, oh, I don't want the bigger, bulkier pump. And so they went for the tubed system because the pump could be hidden in pockets and stuff, and it wasn't stuck to your abdomen or your thigh. And then I also knew a lot of construction workers who kept saying, I keep getting caught on equipment and stuff with my tube system. So it's really preference. You know, the insulin pump that is tubeless, I'm just thinking of swimming. You can swim with it without worrying about it being waterproof. But anyone who is wearing a pump, whether it's a waterproof pump or the pump that's worn on you, if you're scuba diving, you have to take into account that there's pressure, and that pressure will push all that fast-acting insulin into you. So you don't want to scuba dive. I think it's 18 feet, but it might be even less, that you don't want to go below with an insulin pump on.
And then what will be the effectiveness of continuous glucose monitoring and also the insulin pumps compared to just regular monitors? Like, do we really see an improvement on A1C for patients who are using this technology?
So, right. So I'm trying to think how long. I would say it's been about 5 years that these closed loops have started. One pump was 5 years ago. Another pump manufacturer was about 2 or 3 years ago, and they're actually still upgrading and updating their systems and getting the approval. You know, at first, sometimes they were just correcting you from stopping a low. Now they're correcting a high. so it depends on the pump and the algorithm that's set up and I guess approved by the company, and that company owns that. So I know there's always a kind of a war going on between them, and which slows us down with what's available to all of us depending on the manufacturer. But again, you know, the CGMs clearly have lowered people's A1Cs down by points. The closed loop systems, again, they're still newer, but they have noticed, again, points. Again, the lower you get in your A1C, if we have a more normal A1C in the, you know, 6s or 7s, it's a lot harder to drop a full point than someone who's got an A1C in the 14s or 15s. But the control across the board is better with just adding a CGM or adding a CGM on a pump. But again, it's what you need. If you only need metformin therapy and you have great control and your A1C is great, you don't need all this. This is extra.
Yeah. Jana, we're running out of time, but one more question before we close. Children, can children wear these devices, and are they helpful for their families and especially their parents, of course?
Right. So the CGM systems can be used in children, but it's up to a certain age. And actually, off the top of my head, I can't remember it right now because there's so many upgrades and updates in these systems. And unfortunately, I've been out of the pediatric world for a little too long now. But they are approved in children, the insulin pumps as well. But across the board, the Freestyle, even the one that came out for type 2, can be used in children now. But I can't think off the top of my head how young, and I don't want to give you the wrong answer to that. But yes, across the board, the closed loop system, the CGMs, they can all be used in almost everyone. And I don't want to give you the number because if I'm wrong, then that's going to be the number stuck in your head.
And I guess it's going to be great for parents, especially with all those alarm systems that you were talking about, because then they will alert their parents' phones if something is happening with their children. So it will give you a peace of mind. That's one thing.
Absolutely. Absolutely.
Okay, Jana, no more questions. We are running out of time. I could talk with you forever about these devices. Thank you so much to all of our attendees for spending time with us today. If you're interested, I'll see you next week. We're going to have Kristen DiLorenzo. She's the Director of Patient Experience. She's going to be sharing some tips about, in case you get hospitalized, you know, what can you do to have the best experience? Not that being in the hospital is a good thing, but definitely if you can help it, if we can help it as patients, we'll learn how. So I'll see you next week. Jana, thanks so much. And thank you all for supporting our program. Bye-bye.
Bye-bye.